Hey everybody, happy Tuesday. Welcome back to Tooth Savvy. I'm Dr. Brian Yim from York and Bay Dental Office in Hamilton, where each week we'll share with you practical tips on how to be a dentally savvy patient. So this week we're going to talk about what to do if a tooth gets knocked out. So hopefully it never happens to you, but it could happen to somebody around you, so it's good to know. If there's an adult or a child, and as long as it's a permanent adult tooth that's been knocked out, the most important thing is to get that tooth repositioned back into the socket as soon as possible, because timing is of the essence. If the tooth is replanted back into the socket quickly, then you increase the chances of success of the tooth integrating back with the body. So here's what you do. If the tooth is knocked out and it's on the ground, you pick up the tooth carefully by the crown. Now the crown of the tooth is the part of the tooth you can see right there. Do not touch the root of the tooth, because the root of the tooth has very important live cells and tissues that are on there for it to integrate back with the body. So you hold the tooth by the crown and you inspect the root of the tooth. If you see any visible debris on the root of the tooth, then lightly dust that off. Do not scrub the root of the tooth. Then you reposition the tooth and push it up into the socket as far as you can. Now, I totally understand if you're unable to do so or if you're not comfortable to do so. That's okay, because that's what we're here for. Contact your dental clinic right away and get to see them as soon as possible. Now, you're going to have to transport this tooth to the dentist's office without dehydrating those cells and the tissues on the root. So we need to keep it hydrated. The best solution is a solution called Hank's Balanced Salt Solution. Now, personally, I've never seen this solution anywhere in any first aid kit or any facility. So the next best option would be cold milk. And again, at the time of accident or in the location of where the incident happened, cold milk isn't usually around either. So the most accessible solution and the most compatible solution is saliva. So if you got your tooth and you've already cleaned off any debris, then you're going to place the tooth into the pocket of your cheek. So that's where your molars meet this inside of your cheek, keeping the tooth hydrated so that you can increase the chances of success that you keep in the tooth. Then when you finally get an opportunity to do so, transfer the tooth into some cold milk as you make your way to the dentist's office. Call your dentist right away so that they can take the appropriate actions to stabilize the tooth. But most importantly, call your doctor so that you can make sure that your tetanus shots are all up to date. So there you have it. Hopefully it never happens to you, but if it happens to somebody around you, at least you can handle the emergency situation with a whole lot of tooth savvy. Join us on Tuesdays for our most recent episodes by clicking on subscribe. For access to our other videos, click on Tooth Savvy, the one with my picture beside it. And remember, don't keep us a secret. Share us, like us, also leave some comments. I'd love to hear from you. We'll see you soon.